Welcome back. This is Newsnight. Charlotte Maxeke Hospital in Johannesburg was calm today after violent protests by support staff on Thursday. Workers downed tools over unpaid bonuses. Union Nehau is claiming victory, saying the Gauteng Health Department has finally agreed to pay the bonuses. Nehau says the date of payment will be decided on at a meeting on Tuesday. eNCA reporter Zikhona Chona was at the hospital.
Today, the hospital is heavily guarded to avoid any disruptions. Patients and staff are able to go about the business of the day freely. Testing workers blocked entry to the hospital and disrupted operations. They marched through the facility, emptying bins and throwing rubbish on the floor. Patients were turned away and a large number of critical medical operations could not be performed. Nehau has since apologized for the actions of its members.
We definitely do not condone what they did as a union, and we want to apologize unreservedly to the community of Gauteng in relation to the inconvenience that occurred yesterday. However, on the other hand, we want to also indicate that it is well and good that the minister and the MEC are talking about the bad conduct of employees, but it must also be understood that this situation could have been avoided, because it is a matter that has actually taken far too long.
It's expected that there will be no further protesting from staff. Zikhona Chona, Johannesburg.
Well, still on that story, our reporter Khayelihle Khumalo has found a patient whose life was impacted by yesterday's strike. Kaya joins us now in studio to tell us more. So, Kaya, how did you track down this particular patient whose story you're about to tell us now?
Well, Thulasizwe, it was a very rigorous process of trying to convince the patients, to talk to us so that we get an understanding really what happened in light of the very disturbing events as we saw the trashing in the corridors of the hospital. So this is a person who was right at the coalface, and we got an opportunity to speak to her. I don't know if we can now just take a listen to that particular clip where she's really giving us a clear example of what's really happened.
I just thought, because at that point, I mean, I still had the pipes in my legs and stuff. So I thought, yes, I have to run now. Where do I run? I can't even walk. I've got one leg. Where am I going to go? I'm in a wheelchair. I'm just going to have to hope and pray they don't see me.
So it sounds like she's describing what happened at the point at which protesters were entering the... it sounds like she was in theatre, was she?
Well, Thulasizwe, she was just about to go to the theatre, and we know that there has been quite a number of industrial actions in this particular healthcare institution. So she said to me this was not the first time where she was actually, disrupted, just in the verge of her going to the theatre. So it's once happened, and she has been at the hospital for over 8 weeks now, and she's from Cape Town. And I mean, you could really just get a sense from her that it was a very quite frightening experience for her trying to help herself. She's wheelchair bound, but of course, I mean, for her coming here and encountering such a very terrible experience.
So what impact has the strike had then on her life, given the fact that, clearly she needed the kind of treatment that she was going for?
Well, it's quite enormous, Thulasizwe. For example, she was supposed to go for her second operation, and she was telling me of the pain she's just going through, and how, the disruption of the services, and how, in actual fact, the very fact that she's not able to go through to the operation, because now there are so many challenges facing the hospital, issues of linen, in terms of other, services as well, apart from the fact that the strike has ended. But, there are so many other encompassing issues as well that have really just affected her in a big way.
Beyond this one patient, because we're using this one patient perhaps as a snapshot of the kind of impact the strike had on patients, what was the impact? The health minister citing numbers in terms of how many operations were affected?
Well, about 50 operations were supposed to be done yesterday around the hospital, Thulasizwe, but out of that, only 19 were carried out. So Minister Motsoaledi, for example, was saying this is almost tantamount to hooliganism. I mean, no healthcare worker will behave in such a manner, and also speaking about all sorts of issues that they face as the department, but also it speaks about the fact that, I mean, for some time, government declared health as one of the apex priorities, but are they really just living up to that in terms of themselves, in terms of prioritization of this particular field, especially given the fact that the public health care, you know, when you look at a number of South Africans, they rely on it, given the fact that, you know, when it comes to medical aid, in terms of the steep, you know, funds that are required for you to sustain it. So it's really interesting to really see whether, you know, going forward, how will government use such an incident to make sure that really when they talk about priority, it actually becomes a priority?